Perceive, process, perform. Do you need inspiration for your practice? Or do you simply need to practice inspiration? With this series, we aim to do both. Give us 15 minutes and we'll give you practice inspiration. David Schwab is no stranger to the Seattle Study Club Network. He is a professional speaker, author, and consultant who helps dentists grow their practices, educate their patients, and train their teams so that their practices will be more profitable. In this presentation, he addresses the issue of corporate dentistry and shares how independent practices can continue to thrive.
Today's topic is 7 ways that independent dentists can survive and thrive. And we'll give you some really good tips today. You know, one of the questions I get most often is about corporate dentistry, so that's actually going to be point number 1. And I do suggest that if you want to remain independent, that you differentiate yourself from corporate dentistry. Now, we have to be careful because corporate dentistry isn't all bad or evil, not by a long shot. As a matter of fact, many dentists who work in the corporate environment, they're excellent dentists, but we have a lot of independent dentists who say, you know, I'd really like to remain independent, so we'll talk about some tips and how to do that. You know, when I was growing up, my family went to an independent pharmacist. The man's name was Mr. Anderson, called it Anderson's Pharmacy. He was a really nice guy. He had sort of steel-rimmed glasses, white hair, lab coat. He would fill the prescriptions himself, and he would go down the aisle, and he would help people find things. He was really the quintessential small businessman, the independent pharmacist. Well, look around. You don't see very many independent pharmacists anymore. They've all been gobbled up by those large pharmacy chains. And I've got dentists coming to me saying, you know, I'd really like to remain independent, so what can I do? So here are some tips on that. First of all, focus on your strengths. Your strengths as an independent dentist is that you provide the best of both worlds. What does that mean? That means that you provide the great customer service, but at the same time, you provide leading-edge dentistry. So think of it as old-fashioned customer service meets modern dentistry. It's really quite a powerful combination if you think about it. And as you go forward and look at independent dentists, I see people who call patients at home, who will stay late, who will see patients if there's an emergency, really an emphasis on personal care. And because you're a member of the Seattle Study Club, you're always on the leading edge of what's going on. So those are your strengths, and that helps distinguish you. The next thing I would say is that you have to remind patients of what we call continuity of care. And in some corporate dental environments, there are dentists who see the same patient over and over again, but that's not always true in corporate dentistry. But in your practice, remind patients of continuity of care. Tell them, I'll treat you, I'll eventually treat your children, I'll eventually treat your grandchildren. I'll be a constant in your life, and that continuity of care really means a lot to patients. Next, let's talk about the fact that you can stress that your practice is really patient-centered. Now, what do we mean by patient-centered? It means that every decision that you make in the practice is seen through the prism. Is this good for the patient or not? Because nowadays, we've got a lot of patients who say, wait a minute, I'm a little skeptical. Everywhere I go, I think somebody's trying to sell me something. But in your dental practice, you're saying to the patient that we are very comprehensive in our care, but at the same time, we're very conservative. And we always ask the question, is this good for the patient? And if it is, we'll do it and you'll get a benefit. But if it's not, don't worry, we're not going to recommend it to you just to be recommending it. We really have your best interest at heart, and that's what patient-centered means. The other thing we want to do is to show patients your passion, because as an independent dentist, you are passionate. It's your name on the door. You're not just punching the clock and trying to collect a paycheck. It's your name on the door. You're the one who has the passion. That's why you work so hard. That's why you put so many hours in. So let's make sure that the patients see that passion coming through. Now, The next thing I would say, if you're trying to differentiate yourself and you're trying to thrive in this environment and really do well as an independent dentist, is to write personal notes. I'll tell you what I mean. I'm the type of person who loves email and texting and social media and all the electronic media, but at the same time, I know that sometimes you have to break the pattern and go back to the old-fashioned personal note. Think about the patient coming home from work and looking at their mail. They divide it into 3 piles. There's the A pile, it might be a bill or a check, something you have to open right away. The B pile, I don't know, is this personal? Is this advertisement? I don't even know what it is. And the C pile, this is obviously going to go in the round file. Well, we want mail to go to the patient that they open. And I know that your practice management software will kick out letters to patients, but I believe in the personal approach. And here's how that can really work. If you have a hygienist in your office, and I realize that not all of you do, but if you have a hygienist in your office, this will work great. And if you don't have a hygienist, your assistant or somebody else can do it. But think about patients who are 6 months delinquent, 9 months delinquent, 12 months delinquent in hygiene. If you have your hygienist take thank you sized cards, not cards that have the words thank you on them, but that size, and write a little personal note to the patient. Put it in the envelope, hand address it, hand address the return block, and then put a stamp on it, and the commemorative stamps work even better, and then send it out. Now the patient comes home from work and they see they've got this small little personal thing. It could be a thank you note, it could be an invitation. What is it? They're intrigued, and they open it. And that's the whole thing, to get them to open it. And the doctors who are doing this report that the patients say, this is personal, I appreciate it, and they do get calls from patients. I know I need to make an appointment, I know I need to follow up on treatment. So the personal notes can be a very nice adjunct to all of the electronic things that we do in an office. Next, I always tell doctors to get on the telephone. You ask me what's the most important piece of equipment in that office. Is it all the high-tech dental equipment? No, it's something invented in the 19th century. It's the telephone. And here's two quick tips. First of all, if you have a patient who's appointed and they're coming in a couple of days, doctors, think about this. At the end of your day, call that patient whom you haven't met yet. You might get voicemail, and that's absolutely fine. Call that patient on the phone and say, I'm Dr. Smile. I see that you're on my schedule. My staff has told me a little bit about why you're coming in. I'm looking forward to meeting you and answering all your questions and getting to know you. Believe me, that patient will be so impressed even before they came to your office. You don't get that kind of service in every practice. The other way to get on the telephone is after a case presentation. Call the patient on the phone. Again, you might get voicemail, but that's all right. And say to the patient, this is Dr. Smile calling. I know that we reviewed a lot of information today when you were here about your treatment. I just wanted to make sure I was clear. So when you have questions, notice I didn't say if, when you have questions, give me a call. You're not selling anything. You're not talking about negative sequelae and you'd better act now or terrible things will happen. That's not what you said. What you said is that you are available to them and you care about them, and believe me, that just goes such a long way. I also recommend to you that you use what we call green light referral messages. Everybody knows that everyone on the team should be giving out messages that we accept new patients, but I can't tell you how many practices I go in and they stumble over this. So I spend a lot of time with practices working on scripts. Whatever your script is, your staff needs to know. It's in their job description. It's part of what's expected that they get the word out to patients. And when a patient comes in and says, thank you so much, this was much better than I expected, oh my goodness, I was worried about it, but it worked out great, we have to have people who are trained to say, thanks so much for the compliment. You know, Mrs. Hagenlooper, we don't advertise much. You're not going to see us on television or hear us on the radio. The way we grow our business and grow our practice, it's through great patients like you who go out and tell their friends. So we really appreciate your confidence, and the best compliment you can give us is to spread the word for us. And patients react to that, and they want to help you because they like you and they trust you. But we've got to have the staff trained and primed, and we've got to work with them to find the scripts and the exact words that they're comfortable with, okay? The other point I would make to you, one of the other points is answer the phone during business hours. If you're running a real estate business, then you can run the whole thing on voicemail. But if you're running a dental practice, my suggestion to all of you is that you answer the phone during business hours, and don't let the voicemail have the normal outgoing message, the one that you have after hours, the one that you have on weekends. This is what you do in case of emergency. That's not the message you want. Try to answer the phone during business hours. If you can't do it for any reason, if you're just too busy, then change the outgoing message. And I'll give you a good one. It's 10 o'clock on a Monday morning. Somebody's at work. They've got a 15-minute coffee break. They've got a short lunch hour. They're really busy. They've got to get you on the phone. They can't really handle the voicemail, but you can't answer the phone. So here's what we're going to do. We're going to change the outgoing message to say something like this. Thank you for calling our office. You can give the office name. Thank you for calling our office. We're here today. We're in the office, but all the lines must have rung at once. That's why you got this message, but please leave your name. Please leave your phone number. We promise to call you back in 5 minutes. And if it can't be 5 minutes, say 10 minutes. But 5 minutes is powerful. And the person says, well, if they're there, if they're going to call me back in 5 minutes, I'll leave a message. So many offices miss patients. They never get that appointment because the patient goes on and talks to the next dentist, the next office, because nobody answered the phone. So we don't want that to happen to you. I always suggest that you outsource tasks. Think about it. The people who are working in your office, when I walk into a dental office, what do I see at the front? I see desk, chair, computer, phone, desk, chair, computer, phone, right? How many of those setups are there? 2 or 3? I want all of those people interacting with patients. I don't want any of those people doing things that could be done elsewhere, such as making outbound phone calls to confirm patients all day long, or calling insurance companies, or doing accounting or bookkeeping, or stuffing envelopes. Some of those tasks can be moved to the back. Some of them can be moved off-site. Everybody working in that office who's visible to the patients should be interacting with the patients. And all those other administrative tasks don't need to be done in front of the patients, because we need the people who are there to be interacting with the patients and doing the great customer service that you're known for, right? And I also think that it's extremely important that you define the position of office manager. And I want to give you a few different models for office manager, and we can look at that, all right? First of all, the one model is, I talk to doctors who say, well, you want to talk about different types of office managers. I don't have one. I don't have an office manager. But my response to those doctors is this: with all due respect, you do have an office manager. Doctor, it's you. You're doing that job. Is this a good model? I don't think so, because the doctor has to do all the clinical work and at the same time manage the whole office and think about all of the administrative tasks. There's got to be somebody on the staff who can take this pressure off of the doctor. There's got to be somebody who can do that, and that's going to be the office manager. So that first model, we don't have one. Not really sure I buy that. I think the doctor's fulfilling that role. Next, we've got the model of the de facto office manager. This is a situation where the doctor says, well, we don't really have a formal office manager, but there's somebody who's kind of my go-to person. There's somebody that I'm leaning on to get some of these tasks done over time. But here's the problem. That person has no title. That person has no responsibility, no authority. It's just that the doctor sort of relies on this person. This creates all sorts of confusion and conflict within the office, because some of the other staff resent this. They accuse the doctor of playing favorites. This is not a good model. There's no such thing as a de facto office manager that actually works out. Then you get the office manager in name only. This is the person who actually has the title. It says office manager. They've got the title, but they don't actually have the authority to do anything. It hasn't been delegated to them. So it's in name only. And that violates the number one rule of management, which is there can be no responsibility without authority. If you want to set somebody up to fail, give them a lot of responsibility and no authority. That's not fair to the employee. It's not fair to the staff. And it creates all sorts of problems and conflicts. The other model we would have is the office manager who really does not manage. The office manager who really does not manage, this is the situation where we've got somebody who may have the title, they've got the authority, they've got the responsibility, they may even have additional compensation, but they don't lead. All they are messengers. So they're not the office manager, they're the office messenger. And all they do is take messages back and forth, doctor to team, team to doctor. Well, it's really expensive to pay for this messenger because they're not really doing their job. They're not making the decisions. So what we really want to have as we go through is we really want to have somebody who is the office manager who really does do the job. They've got the responsibility, they've got the authority, they've got the salary if necessary. They certainly have the title, they have the confidence of the doctor, and they are helping to manage. Now, we understand that the doctor is the CEO. We understand that the doctor is the ultimate decision maker, but the little things that happen in an office and the daily things, those have to be delegated to a true office manager. And by the way, I'm not just talking about the office with 20 staff and multiple doctors. If you're running a practice with just a few staff, somebody's got to be in charge. And that's why we call this person the office manager, and we define their job, and we give them a job, and we give them the authority to do their job. It makes the place run much more smoothly. So let me just summarize some of the key points here. If you're going to survive and thrive, we talked about differentiating yourself from the corporate. We talked about differentiating yourself from the corporate so that you can set yourself apart and have all of your strengths, right? And we talked about those personal notes, which is just a great idea, and it reaches out to patients, doesn't take a lot of time. As a matter of fact, you can do that during a broken hygiene appointment. It's a great use of time when somebody's not busy doing something else. And we also talked about getting on the phone, calling maybe the new patient before they even get there, or calling the patient who had a case presentation, but now they just need a little bit of personal touch as a follow-up. The green light referral messages are absolutely critical. I want people to use their own words. I want them to feel comfortable, but it's everybody's job, and it's got to be built into the job description to get the word out to patients. Because as I go around the country and I talk to doctors and I talk to patients and I sit in the reception areas, I've talked to patients and asked them, does this practice accept new patients? And I would tell you through my own admittedly anecdotal surveys, not scientific, but going to a lot of offices across North America and beyond, about a third of the patients say yes. The practice does accept new patients. That's green light message. About a third of them say, well, I'm not sure, so that's yellow light message, and they won't refer. And the other third of them, I've had people look at me and say, I don't think you can just come in here. I've been coming here for 20 years. I don't think you can come in here. So your best patients are trying to protect you from riffraff like me. But what I think you should do is tell the staff that we don't want referrals from 33% of our patients. We want referrals from 99% of our patients. And that's why that's so important. And we also say that we want to answer. We also say that we want to answer the phone during business hours so people know you're there, because we live in a very busy society, and the idea that they're going to call you back is not always guaranteed. Want to outsource things that don't need to be inside so that everybody who's working there is taking care of patients and not doing administrative things that could be done off-site or at home or somewhere else. And certainly, we want to define that office manager role so that it's clear and it works greatly for the practice. So let me just sum up this way. If you're going to continue to survive and thrive, then put these tips into place and see your practice grow. And I also think if we hark back to what I talked about at the outset, Mr. Anderson, the independent pharmacist, I think that ethos is very important, and there ought to be a little bit of Mr. Anderson in all of us. Thank you very much.